later. Good morning. My name is Cheryl Henry, and I'm going to be your facilitator for the online internship. I'd like for you right now to focus your attention on the orientation agenda. This is very important. I'm actually going to be sending out everyone. One of the reasons that I asked for your phone number and your email address is because once this recording is rendered, I'm going to be sending you a copy of this sheet for review and reference, along with a copy of the YouTube video of the recording that we're doing today. But I still need your attention. So let's start from the beginning. What I'm going to do is, after I give the preliminary information about myself, I'm going to read this document that you'll be referencing. Very important. So this is Mod 160. You will be starting, we say session 6, even though this is your orientation. As you'll see once I do the demonstration, the internship itself is involved in about 9 sessions, I believe. And each session deals with a specific aspect of the task and the curriculum that you were exposed to, the task involved in the curriculum that you were exposed to. And you'll know more about that as I move forward. So it's labeled session 6 so that you can make a note that you begin on session 6. You'll see when you open up the course, you will see 9 sessions. Click on 6. That's very important. I've had students start on the wrong session because they're not listening. Okay, and what happens is that when they open it up and they see session 1, they go, "That's where I start," but that's not where you start. All right, you'll get to session 1 eventually. These are my I'm a certified professional coder, and I also have an added certification in instruction for coding curriculum for people who are being certified. And I also have other levels of education, just to let you know a little bit about myself. Take my phone number, 909-610-9649. Take this down. The best reason to use this is if you're in a pinch and you have an urgent need to know something immediately. The best way to communicate with me is by texting me at this number. If you call, I might not be able to get to the phone, but if you text me, I'll be able to see the text. The best way to reach me for non-urgent matters is via my email, cheryl.h@success.edu. Okay, so let's go forward with this, with the orientation. I'm going to go ahead and read what you see here. The overview of the components of the virtual externship. The MIBC virtual externship is meant to simulate the tasks routinely performed by a medical insurance biller who has some fundamental knowledge of procedure, CPT, and diagnostic ICD-10 CM coding, and an understanding of the billing cycle in the ambulatory outpatient physician office setting. Thumbs up if you know what a revenue cycle is, or billing cycle. Good. Everybody online right now should have their thumbs up. Okay. The MIBC virtual externship is formatted in 9 sessions. Each student begins their virtual externship based on the same modular format followed during your core courses. That is, you will begin in whatever the current session is. This week, we are beginning session 6, and this is where you will start. Each of these sessions involves performing various tasks you would be expected to complete if you were working in an individual facility or physician's office or an actual medical billing business. This includes insurance verification, pre-authorization for service. That's done in session 1. You're not there yet. Scheduling appointments and entering demographics, completing super bills and submitting claims, and continues in session 4 with all the fundamental tasks in the revenue cycle. This includes the previously listed tasks, plus posting explanations of benefits. Everybody knows what an explanation of benefits is, right? Okay. Also included in each session is a requirement for procedural and diagnostic coding of a variety of reports. As part of your virtual externship, you will be required to utilize 2 resources on your Evolve platform. The first resource is a simulation playground within SimChart. Thumbs up if you're familiar with the simulation playground. Good, good, very good. How about you, Ray? Have you ever used the simulation playground? No, I guess that's a no. I can't hear you, but I'm thinking it's a no.
So no.
No, okay. So I'm going to show you what that is, and it's really important to become as familiar with this as possible. Let's see. As part of your virtual two resources, that would be the simulation playground within SimChart for the medical office. The second resource is Buck's simulated medical coding internship. And again, because I have written your name and your campus and instructor on this index card, I'm going to make sure that your campus presidents know and that the instructors know that they need to, if they've taken you off the roster, you need to be back on. Chances are right now, because the grades aren't actually due until Monday. When did y'all finish? When did you guys finish? Danielle, go ahead.
Sorry, I technically finished Thanksgiving Day.
Okay.
So that was, they were looking for me a site, and then just with the pandemic and stuff,
Right.
I just decided to go online because I have two small kids.
Right. And speaking of that, any of you who were on a site or was assigned a site and you weren't able to do it because of the pandemic, there is the ability, okay, they give you the ability, or they give you the freedom that if they do find a site, I'm not sure if they're going to find one right now because everything's in shutdown, but you can come off of the virtual externship and go onto a site. This virtual externship makes it so that you don't lose hours and you don't lose time. You can just keep going while you're learning something. And I have had students tell me that some of the things that they've learned in the online internship, they were able to apply when they got pulled off and put on a real site. So it's all good. Okay, thank you. Let's see. So what the reason I ask about that is because I am going to have to contact your instructors and let them know that they need to put you back on. That's not usually a problem. All right. So therefore, we ask that you request that your last instructor keep you on the roster for these courses within Evolve, or add you back onto the roster right away. All right. So what y'all should do when we're finished today, email your instructor and let her know. They know by now every name of every instructor that I've gotten. Miss Alvarez is real aware. Miss Connie's very aware. Mr. Davis is aware. I've had many of his students, and Miss Volter, so they all know. So as soon as we're finished here, go on and email them and let them know they need to put you back on the roster, like right now, today. Okay, that way you save time. All right. Inform me immediately if this does not happen. No, so now moving on, I'm going to outline some academic resources that I strongly suggest you utilize during your virtual externship. You're going to need them, trust me, because some of what I'm seeing, for example, let's see what we have. Yeah, I'll wait for this for later on. But in every single module, in every single week, in every single session, with the exception of the first two, I believe, you're going to have to manually complete a CMS 1500 with a template that I have. The reason that I have you do that is because because everything is automated, and because when you work in SimChart, or for that matter, even when you get into the field and you're working in the field, you actually can do an output of a CMS 1500 that is already there, right? But what I'm finding is that students are not familiar enough with the form itself. So even in externship, I'm finding mistakes on the CMS 1500. And what I'm going to do is I'm going to pull over right now an example of some of what I tend to see as one example. This is a CMS 1500, or a snippet from the book, I should say. One of the biggest errors I see when students are creating the manual CMS 1500s is that they, for example, do not attribute a diagnosis code with the procedure that's being billed. They don't put the place of service code. They don't put the units. And what this means is that they're actually not really familiar with the CMS 1500. Now, why would I want you to be familiar with the CMS 1500? Because you're billers. You know, once you finish this program and you show somebody your diploma, they're going to say, "Ooh, you know some things," right? And at the end of the billing cycle, all right, so we begin with the demographics. Patient comes in, they're seen, you compile charges. There's a super bill that you use to input charges into the system. You generate the charges. You send the claim to the insurance company electronically, usually. And sometimes when the insurance company receives that claim, it's not complete. There's something missing. And what they'll do is they will sometimes say, let's say, invalid diagnosis in box 21, or invalid place of service in box 24B, etc. You have to understand what all this stuff means. And what I'm finding is I have had students just recently, I had a student actually put a CPT code, put the office visit here where the diagnosis codes go. I know that sounds crazy to some of you, but this has happened so many times. And it tells me that students don't know what this is, and they don't understand how to relate to it. And again, the reason that I have you do it, along with all the explanations, benefits that you have to post, is because you need to know what this stuff is, and you need to know what it means. So, with that said, in your Fordneys, your blue book, I'm gonna get mine and show you.
Miss Cheryl?
Yes.
I do have a question though, because when I started class back in March, I got books, like all my textbooks, but all of my stuff was like the older version of it. And then the person that came like maybe 30 minutes after me got all of the current stuff, like all of the newer textbooks. Is that going to be a problem for me with this?
Yeah, it is going to be, mainly because you need to. It won't be so much that. Excuse me just a minute. I have to look. Here it is.
Because, like, I have the PMIC 2019, but the guy that came 30 minutes after me got the Carol J book 2020.
Oh, okay. So did you get this book? The blue one.
I do have that one.
Okay.
I do have that one.
So this is the one you'll need. The blue one.
Oh, okay.
Okay, that's so in answer to your question, it's not going to impact you. The most important book you have is Fordneys. All right? That's what, okay.
Sounds good.
All right. So, and if everybody has their Fordneys book handy, I'd like for you to pull it up, because I need for you to reference something and see with your own eyes, because I'm unable to locate it here. Let me see. Yeah, it's not on the same page as it is on my e-copy of the book. So, chapter 4, Insurance Basics. I strongly recommend that you review this chapter so that you can remember. I don't know how recent it has been since you've left the module, but it's important that you review this chapter so you can sort of think about what goes on with the billing and what you're doing. Specifically, reference page 65 for the revenue cycle. So if you have your books handy, turn to page 65 very quickly, and you'll see what I mean. The revenue cycle looks like this, because this is what you're going to be doing in the internship. You're going to be entering demographics. You're going to be entering charges from a super bill. You're going to be creating a claim, and you're going to be outputting that claim. You're going to be posting payments for the claims that you output. So it's important that you familiarize yourself with that. The second most important thing in the book is chapter 14, the completion of the CMS 1500. That begins on page 300 of your textbook. And you saw a sample of the form that I actually pulled up as an example, but this was actually a specific portion of that form. But in addition to having specific step-by-step instructions that I really need you to use, in addition to that, what we have here is we also have examples of completed CMS 1500s. So I'm going to pull one of these up for you. Okay, it's not showing. I'm going to move on because I don't want to use up a lot of your time. But specifically on pages 326 to 334, there are specific examples of CMS 1500s for various insurance carriers. So you know how to do these. Now, one of the things that I want you to keep in mind when you're doing these manual CMS 1500s is that you should be compiling these for your portfolio. Okay. Now I know, how many of you did a senior binder? Did you guys do those electronically? Right.
For my class, we basically had to turn them in.
Okay, so my class is doing them electronically. And there are components of your senior binder that's not just, your homework and all that stuff, because honestly, employers are not going to want to look at all that stuff. Your binders are really thick, right? We don't need that. What you need is a portfolio that's about an inch at the most, a half inch preferred, that demonstrates that you know what a CMS 1500 is, you know what an NAOB is, you know what a ledger is, you know what a super bill is, okay, and you know how to do them. So with that said, it's really important that these pages in Fordney are referenced so that you know exactly how to complete a CMS 1500, especially the step-by-step instructions, okay? So keep that, and keep this book handy, okay? The other one, what I'm going to do now is attempt to pull this up. Very, very important would be page number 65 of your Fordneys. I'm sorry, 365. I apologize. Page 365 of your Fordneys has an example of the components of an explanation of benefits. And I'd like for you to make a note of that. And I also need you to read, before you start, it's really important for you to read from explanation of benefits to the components of an explanation of benefits, interpreting an explanation of benefits, posting an explanation of benefits. That's what I need you to know, because that's what you're going to be doing in the class. Very important to review that. And again, I realize that for some of you may have just finished this module that you actually read this chapter in, but for some of you it may be in the distant past, and for that reason it's important that you use and reference this book. Okay. Let's move on. Now what we're going to do is we're actually going to do an overview of session 6. In session 6, you're going to be using the simulation playground to schedule appointments, to enter demographics on a patient, to complete a super bill, to submit a claim, and to post payment. In addition, you're going to be doing the manual completion of a CMS 1500 based on one of the patients that you entered. And this is why this is so easy, because all you have to do, as you know, you enter a patient, you're going to do the whole revenue cycle on this, okay? Among them, submitting a claim. Take one of those claims and transfer that information over to the manual CMS 1500, and you'll have it made. This is one part that I like to explain, mainly because students struggle. There's a couple of ways that you can get this information, that I want you to get this information. One of them is by understanding each one of these boxes and doing the step-by-step walkthrough of the completion of a CMS 1500. At the same time, you already have a CMS 1500 that's completed, that you can actually transfer that information onto the manual one. But I need you to understand what you're doing. This is why we reference the step-by-step. Got it? Okay. So, yep, the manual completion of the CMS 1500. In addition, a YouTube video on the elements of an explanation of benefits. Each week, each session, you have to do a YouTube video. I know I know for some of you it's like, really? Yeah, but it's not that hard. All right. And what I'm going to do now, you have to do a YouTube video that is based on the primary focus of what we're doing on a weekly basis. And this week we're going to be focused on explanations of benefits. So I'm going to minimize this. This is what your online internship looks like. This is the Zoom link that you're going to use once I register everybody. When we're done here, I'm going to enroll everyone in the course, and at that point you should receive a link for the course itself. We are in, as you see on the side here, you see all the sessions. Where you're going to be starting is session 6, so I'm going to click that, but I just remembered something. I'm going to go on up here. With regard to the YouTube video, there are instructions for creating a YouTube channel at the beginning of the internship. And it's right here. And it literally will only take you 5 minutes to do. I have a YouTube channel. I had to make one because I post YouTube videos for students. So the instructions are here. This should probably be once you get the link from me indicating that you're enrolled, go ahead and make your YouTube channel. Okay? Anybody have any questions so far?
Does it have to be like, because I have editing software, but does it have to be like all professional?
No, the only thing, that's a good question. No, these YouTube videos need to be no more than 1.5 minutes or 2 minutes. For example, this week you're going to be explaining the components of an explanation of benefits. All right. All you have to do is use that reference on page 365 of your textbooks that has a sample of an explanation of benefits. Before you do your YouTube video, look at this example and speak about what you know. And it should take no more than 1.5 minutes or 2 minutes. The only thing that I would ask is that when you record your YouTube video, you're dressed like Danielle. You have your uniform top on. I've had students record the videos with tank tops on and all that. That's inappropriate. Yes, Lainey.
Because I do distance learning, I never got a uniform. What should I do?
Dress professionally. Have a professional top.
Okay.
Okay. All you have to do, you know what that means. Just don't wear a tank top. Okay. I've had women. You know the lace, little nice tees we have with the lace and little spaghetti straps. I had a student do a recording in one of those. I'm like, oh my God, this is something that we might have to show a prospective employer. Just keep that in mind. Okay, so do this first. Okay, let's go to section 6 and look at what your format looks like. Okay, so first of all, the first thing you do when you get these are this is a previous recording of session 6. You can look at this if you like, but the YouTube video is going to be more relevant to you. The link I send you is going to be more relevant. But once you register, once you get the link that you're in, you can go ahead and look at that. In addition, this file has overview and instructions. You may not need that once you get the video from me. But one of the most important things is that this video sometimes takes a while. The YouTube video it has to render, and then I have to go to my channel, fix it up, and then make a link, and then send everybody a link. This might take until Monday to do. All right? I don't want it to. I want to get it to you today. But in case there is a delay, keep in mind that all you have to do is reference. The first thing you do when you get into this course is reference the checklist. I have this here so that you can keep organized about what you have to do. You having a hard time seeing, Danielle? Is it too little and want it bigger?
It's not necessarily that it's too little. It's just the print is just a little fair. But it's okay.
I got it. I know why. And it's mainly because I'm going to pause the recording right now. It's mainly because, so as I was saying at the beginning of each session, now you can see it a little bit better. There's a checklist of activities. If you follow this checklist, you will not go wrong. All right. So for example, the first thing that you'll do when you go in is you open the folder named Files for Completing Simulation Playground Activities. The second thing is access the appointment schedule for session 6 files and follow the instructions for creating an appointment for each patient under Hidden Cities in the appointments file. I'll show you that in a minute. The next thing you do is enter demographics and insurance information on all the files. Then you create an office visit, super bill, and claim for each patient. Keeping in mind, all of y'all should know how to do this because you've worked in SimChart. Post payments with the explanation of benefits that are provided. Manually complete a CMS 1500 using a patient of your choice from those you've entered. Code all the reports that are listed in assignments 1, 2, and 3. Print all files. Once you're done with everything, print everything that you're required to submit as PDFs and submit these in the respective drop boxes. And last but not least, to impress a prospective employer, you have been asked to create a 3 to 5 minute. It doesn't have to be that long. I've discovered that it doesn't have to be that long. I'm actually going to edit that. Demonstrating your understanding of the components of an explanation of benefits. What I advise you to do is talk about what you know. Don't try to push it and create things that you don't know, but talk about what you know. You're not supposed to know everything. Nobody knows everything, but you do know something, okay? Here are the objectives, and here's where we get to the guts of things. know here that for each one of these steps that I outlined in the checklist, there are specific instructions on how to do it. The only thing that may not be so specific in the instructions is entering demographics, because in entering demographics, there are two phases. The first phase, when you go in to create the appointment for the patient, it gives you the opportunity, as you know, to create a new patient. You should create that new patient, but that is not the same as entering demographics. What you have to do in the second phase of that, the second thing you do is enter the demographics on the patient. If you only enter the patient as a new patient, when you go in to do the claims and everything else, especially creating an office visit, you're not going to find it. You're going to get a message that says you have not completed the registration of this patient. Do you want to? So keep that in mind. So again, all the instructions are here. And let's look, and these are your drop boxes that you'll put your assignments. All the assignments are here. And these are the files that you will use for completing your activities. While I'm showing you this, I will explain to you that what we're doing with the online internship is we're combining two resources that don't know each other. I have special permission from one of my colleagues to use some sample resource or basic documents like the demographics, the super bills, etc. I have her permission to use these to facilitate the online internship. Her documents don't know SimChart. They're not related. So what you're used to is having things in SimChart that are there for you to pull up and do your exercises, which are a lot of clicking, a lot of basic entering. So you're prepared for this. This is different. What this is like doing it from scratch. For example, for each one of the patients, let me just go back here to this folder. Oh, I'm sorry. Let me go back to session 6. For the appointments, all right? And I will out scheduling an appointment. I'm going to click this because this is for the scheduling the appointment is for new patients. When you click this drop box, this is probably one of the exceptions, all right? The appointments are not in one of the files, but it's in the actual drop box. So make a note of that. You will click Hidden Cities Appointments. This is a mock clinic. Download the file. And for this mock clinic called Hidden Cities, you have patients in 4 or 5 different clinics. Okay? So you'll always be, for the next few times that you do the work in the online internship, you'll be using Hidden Cities. Now, for the session that you're in now, the instructions are specific to making appointments for patients in Hidden Cities 1 only. Next time, you're going to do Hidden Cities 2. After that, you're going to do Hidden Cities 3, etc. All of these have different types of clinics to give you exercises in doing different kinds of charges. This is a dermatology clinic. So you only enter 1, 2, 3, 4, 5, 6, 7 patients. All right. Once you enter those patients, I'm going to go back to the assignment itself, session 6. You have to schedule the appointment for these patients, do a printout of the screen and drop it in the Dropbox. Going back to session 6. Once you make that appointment, the next step that you're going to be doing is you're going to be entering demographics. The files for the demographics are actually located in the files for demographics and insurance information. Click on this. When you open up this file folder, what you will see are demographics. The demographics for each one of the patients that you made appointments for, excuse me, are just like they would be if you had to enter them manually. Now, granted, I understand, excuse me, I have to, in today's technology-driven environment, Many times this information is already going to be in the system because patients can register on a portal and it's all there. But for the sake of understanding that visual, tactile thing that we as human beings need to experience in order for knowledge to become a part of us, for that reason, we're having you do this manually. And you may have to end up doing it manually. There's still many offices that have not made the transition to all electronic health records. So there's a lot of things, a lot of different places. So these are demographics, and this is really how demographics look. All of these components that you see on all of these demographic sheets are going to actually have to be entered into SimChart. So as you know, for SimChart, when you everybody has SimChart. Let me go to my Evolve, show you where to start. Everybody has SimChart. Sorry about that. You know how to get into SimChart, but I'm going to walk you through this very quickly.
I did. I went to SimChart and it allowed me to go in, but it's not allowing me to actually go into the playground. So I guess I will have to contact Ms. Bolter.
So you're actually still on the roster?
So basically, I still have it where I'm able to click into it, but it doesn't, like, when I go to content home, it literally is blank now.
Yeah, you would have to contact her. So I'm going to click on the SimChart for the medical office that I use. I want to point, keeping in mind that the resources that we use have nothing to do with what's in SimChart. You're going to have to put everything in there. With that said, even though you have situations where you have patients who aren't in SimChart, you're going to have to add them, and specific physicians. For example, the physician here is April Carter. You're not going to enter April Carter. Every single patient that you enter is going to have Julie Walden as their physician. Okay, that's just how we have to do it. Okay, and that's on the instructions. So you open up SimChart. So what you're saying, Danielle, and this is going to open in a different window, is that once you open up SimChart, it's a little bit slow because it's recording. So maybe I would.
When are the assignments due by?
They're due Thursday at 11:59 p.m.
Okay.
Okay. So we're in SimChart. I have a lot of them because of teaching. So of course you only have one. And so you don't see this. Okay. So we'll get that. So when you open up your SimChart, don't pay any attention to all those other things that you've already done, but you simply click Simulation Playground. No matter what happens, even if you have a question, Danielle?
No, I was just saying, like, yeah, no, I don't have any of that.
Okay. Do you still have your access codes on that access card that you got with your books?
I think so, but I'd have to look for it.
Look for it, and if you still have it, and if your teacher can't add you back onto the roster, which she should be able to, I can have you register for my course, but I don't like doing that because there's always problems with accessing, because students use the access code once and can you use it again? So I want your teacher to put you on there. Okay. It'll be okay. Don't worry about it. You'll be fine. It always works out. I know it's frustrating because it's out there now, but it always works out. Okay. So when you open up the Simulation Playground right here, do not go to SimChart. Always, even if it's your first time, always click Return to Previous Session. It's not logical that if you don't have a previous session, that you can't just start a new simulation session. It's not logical. But do this every time, even the first time. Okay? And then you start. And this is where you get to do these activities. So when you open up the screen, the first thing that you're going to see is the appointment scheduler. That's where you schedule your appointments. The second thing that's going to happen as you're going down the checklist and following all of the instructions step by step is you're going to be asked to do, so you'll schedule the appointments here. You print them up as a PDF, like when you, for example, you'll be able to select a visit type. You can always put new visit, because this is just making the appointment. You can put unknown, or you can put something in there. You always check create a new patient, which again does not give you, all right, it does not necessarily give you, it won't give you the demographics. All right, so we'll click Amy Jones. You can put a date of birth in here. You can choose a date of birth. She's 9 days old, female, phone number. I'm just putting random numbers in here. The provider is always going to be Julie Walden. The insurance type is going to be the insurance type that's on the demographic sheet. So you would always want to make sure that you have the appointment and at least the demographics up when you're doing this, so that you have logical information around what you're putting in here. And you'll have real Social Security numbers on some of these demographic sheets that you have to put in here. Follow exactly what's there. Make sure that everything is complete that has a red asterisk on it, and you can thereby save the patient. Oh, ID number. It'll let you know for sure, and you can save the patient. And again, this is not the same as putting demographics in. Once you make the appointment, you got to go back and do the demographics. So we're going to pretend that we're making an appointment for this patient. That is a 30-minute appointment, as are all the appointments, and that's it. Once you're done with that, you save it, and then the second, and at that point, you'll see the patient on the appointment schedule. You'll actually see all the patients on the appointment schedule, okay? And this is your appointment scheduling assignment that you print up, and you save it as a PDF, and you put it in the Dropbox, okay? I don't think I need to go, I don't want to spend a lot of time on this because we don't have it. Anyway, once you do that, then the second thing you do, based on the checklist again, is that you actually, excuse me, this is the wrong one. We'll go back to session 6. Once you enter the demographics, you're following the checklist, and the next thing that you're going to do is actually, create an office visit and a super bill. Okay, and where you get things, creating an office visit and a super bill in the simulation playground, and going back to sim chart for the medical office. Get rid of that. Going back to sim chart for the medical office and following the instructions, you go to the clinical care tab. And there are specific instructions on how to make an office visit. So in this case, I'm going to pull up, well, let me just pull up my patients and see. So here's Amy Jones that I just created. And notice what happens when I pull her up and I'm trying to make an office visit. This patient is not fully registered for the medical office. This means I didn't put my demographics in, and this is what's going to happen if you don't. So for the sake of demonstration, I'm going to go ahead and see if I have any, actually. Yeah. Okay. So Monique Jones is in. All right. And this is where you would follow all of the instructions. And again, the instructions are outlined step by step right here for creating an office visit in the simulation playground. You have to create an office visit or you're not going to be able to do a super bill. So keep that in mind. You can't skip any of these steps. And once you create the super bill, then you're going to have to go on and post the payments. Keep in mind that everything you do is clearly delineated. The instructions, the step-by-step instructions are taken from your textbook and put on a Word document. So you shouldn't, the only time that I've seen students not be able to do this is if they skip a step. If they go in and do enter the appointment and they don't complete the demographics, they can't go any further and things are not going to work for them. When they get to the super bill, they're not going to be able to do it. So keep in mind that you have folders, except for the appointment. The appointment is within the appointment assignment, but for everything else, you have folders for completing the activities. Let's take a look at the super bills and explanations of benefits. So for each patient that you make an appointment for, you have super bills. Oh, I wonder where oh yes, you have super bills right here. I'm going to pull one up. But for these patients, the explanation of benefits is on one document. So you have one document, okay, that, for example, let's pull up Adam Coleman. He's the first one that you're going to make the appointment for. What you'll see with Adam Coleman is a super bill that looks very much like the super bill that you're going to see when you review chapter 4. I think it's chapter 4. No, one of the chapters. I'm sorry, I don't. But it looks very much like the super bill that you see. And with these super bills, when you're entering them into SimChart, for this particular session, I have no concerns about you being able to follow the instructions, follow along exactly as they are. But for some sessions, for the next session, when you're doing durable medical equipment, what you have to do, this is one of those that will be a situation where you kind of have to blend these two resources together, and you don't have a fee schedule for these patients that you're entering that matches the fee schedule in SimChart. So you're going to have to manually put the durable medical equipment HCPCS level 2 codes where the office visit is. But I'll talk about that next week. It's really a simple little adjustment, but it's what you got to do. Okay. Now what you'll notice on these super bills is that you have, in this case, we have a patient that has an office visit 99212, and modifier 25 is added to the office visit. So you have to make sure you add that. But what it references on the super bill is that this office visit is with regard, and this is going to help your CMS 1500. This office visit is for diagnoses 1 and 2, and you'll see in this particular, the removal of the lesion. Patient's going to have some lesion destruction done at the dermatology clinic. These particular procedures are related to only diagnosis 1. So patient comes into an office visit, complains of these little growths on the face, right? And so naturally for that office visit, you're going to use both of these diagnoses. And these are what's going to show up on your CMS 1500. However, for the destruction of the lesion, you only need this one. And this is what you... Go ahead.
I was going to say, I don't know about anybody else's program, but I didn't get a HCPCS manual.
Okay, there's a solution to that. So the solution to that is that when you're in SimChart for the medical office, you can use TrueCode.
Okay.
Okay. Sometimes when I'm doing this, sometimes TrueCode doesn't work for me. Sometimes it does. So I'm just going to take a little chance. But you can use TrueCode, and it looks like it's going to open up for me, and you can look up any code you want.
Okay, because I know that when I was in class, for my last module was 130 coding.
Yeah.
And so basically what ended up happening was my teacher gave us a 30-day free trial of TrueCode, but she was saying that once that 30 days was up, I wouldn't have access to it. But you're saying inside of SimChart, I'll always have access, or I should always have it. Okay.
It shouldn't be gone. And if that doesn't work, and I can write this down now, I can give you a link to a free resource for looking at codes.
Okay, sounds good. Thank you. I'm sorry for all these questions.
You don't need to apologize for asking questions. I'm glad you do, because you're the one that's not going to be stuck. Okay, you're seeing ahead of time, and you're thinking about getting your work done without having to revisit things. So, and within SimChart, you can use TrueCode. It should be available. I have not had one single complaint from any students that they can't use TrueCode. So here is where you can choose, of course, we're going to be using ICD-10. You can also use the CPT, and you can also have the HCPCS. Okay. Did you have a question, Lainey?
Are we using HCPCS on like everything? Because
No.
I remember I asked my professor about them, and she's like, "Oh, you don't need to know them. You're never going to use them."
No, you're only going to, you mainly, sometimes, I wouldn't say everything, but it depends on the super bill you get that you have to enter. But specifically for your next session, when you're entering durable medical equipment, you do need HCPCS. Also, with some of the super bills that you're entering, you have to enter a HCPCS code for the drug administration. Okay, somebody gets an injection, not for the drug administration, but for the drug itself. You can code for the administration, but you need a drug code from the HCPCS manual for the specific medication or vaccination or whatever it is that the patient's getting. So that's where you would use it. And it's possible. I've taught the curriculum. It is in the sense that for some reason this book is not used that often, even though you learn about it in step-by-step coding. You don't often use it in within the program, but you'll get to use it this time. Got it? Okay. So you'll create your office visit here. Okay, and you have to make sure you do that. All right. And then once you're done with that, and again, when I'm back at here, oops, that's the wrong one. I'm going to get out of this one. It's taking up RAM. Once you're there and you complete the entry of all the super bills, the next step is going to be you go through the process of creating a claim and putting the output on that claim. And then what happens is you get paid for it. And this is where you enter the payments per the instructions. And since most of you, if not all of you, have already worked with SimChart, this is where you learn about the math. You have to make sure that when you are, and I'm going to go ahead and show you this in SimChart by going to coding and billing and going to the ledger and pulling up a patient that I do a lot of demonstrations with and pointing something out to you. So in the drop-down menu, this patient has a lot of things because I've done a lot of demonstrations with this particular patient. The main thing that I want to point out to you about entering explanations of benefits is that, let me X out of here so we don't use up a lot of memory. We can go a little faster. The main thing to remember about appropriately and properly entering explanations of benefits is that in the modern world, most of the calculations are already hardwired into the system based on the provider. So if the doctor that you work for is a Blue Cross provider, whenever there are updates to the fee schedule for Blue Cross, that is automatically given to you, and it should be populated into the electronic health records / practice management system. So that means that when you're going in to post payments for the charges that you submitted, it automatically calculates the adjustment amount, the allowed amount, the adjustment amount, and the amount that many times you will have to manually do the amount that's due by the patient, but most of these are already done. But in this case, you have to do the math sometimes. So in looking at this explanation of benefits and all of the explanation of benefits, what you have to remember is this. For example, for this first patient that we have here, who is Tennille Welch, we billed for a dermatologic procedure. We billed $265, okay, for the submitted charge. That's what we billed. The allowed amount was $213. What does this mean we have to do when we're looking at the ledger? Let me get out of here. Anybody know? So what was the amount? 265? Was that 265?
Yes.
Okay. And let's take a look at the allowed amount. The allowed is 213, right? All right. So what we have to do is we're going to, and the allowed amount means that this doctor has a contract with this insurance company, and they have agreed to accept $213 as payment. So that means that whatever the difference is between this 213.18 and 265 has to be written off. Right? So y'all are going to have to do manual calculating. And again, just a reminder that you don't necessarily have to do this in a medical office, but you need to know how to do this. because sometimes you will have to. So let's put 213.18 in the adjustment column first. All right? Because everything else after that is easy. In this system, in SimChart, you have to put a minus before the adjustment. You won't have to do this in real life, but in SimChart you do. Usually when your system knows that this is an adjustment, it will automatically deduct, but SimChart doesn't because it's created for practice. Remember when you do the adjustment that you adjust that. You do the, oh, that's too much. I'm sorry. Can somebody calculate the difference between, I put the wrong amount in there and I apologize. The difference between 265 and 213. That's what your adjustment is going to be. Can somebody do that for me? $213.18, I believe. So 265 minus 213. Let's see.
It came to $51.82.
Right. Okay. I think I had that up there, but that's not what's supposed to be over here. So you said 51 what?
$51.82.
Okay, great. So this is what you're going to adjust. Okay. And what's remaining is 213.18. But the payment for this, let's put this, oh, wait a minute. My explanation of benefits went to a different page. So let me move this over. But the payment for this, okay, when we look at the end result, is $170.54, right? And what should be due by the patient is $42.64 once we calculate the payment. So $170.54 is what goes here. And the balance for this line is $42.64. And that is what is showing on the explanation of benefits. If I can find it. Let's see. That should be right here. $42.64. Coinsurance amount for the patient. Got it? So this is what, now on some of the explanation of benefits that you're going to be posting in the internship, they're just like they are in the field. It's all worked out already, and all you have to do is read it and post it. But in others like this, you have to do the math for the adjustment. And I know it's an extra step, and as I mentioned before, in real life, you may not have to do this extra step because it's going to be hardwired and pre-populated into your practice management system. But I have found it's important to do this because what's going to happen is you're going to be reading EOBs. And you're going to have to determine whether or not the EOBs are right. Sometimes you have to submit for, sometimes they will calculate the wrong approved amount based on the contract. So there are things about this. There is value to be gotten from this type of exercise. All right, any questions so far? Last but not least, I'm going to X out of here. I hope I don't, yeah. Okay. And this, and at the end, the end result should be for this particular patient, ignoring all the rest of these, the end result should be that you have the same balance for this patient that should, in every case that's showing on the explanation of benefits. Okay. Back to your internship and back to session 6. And to show you briefly, I almost made it. I don't like taking more than an hour to do this, and I don't think it's necessary. But for the rest of what you have to do, you will have to code reports for every session. This session, the reports that you're coding are reports that are already in the internship. And I think I got a thumbs up for everything where everybody actually has used a simulated internship, right? Right? So you know where it is and you know how to find the reports. That's all these are. So this, you have evaluation and management, you have medicine section, and you have surgical pathology. What you submit in your drop boxes, you submit your answers. So you know how you can submit it and you get an answer? Do a PDF printout of that and submit that in a Dropbox so I can see you've done it. For some of you, this is more challenging than for others, and I understand why. And the reality is that these reports are, I would say, intermediate to advanced level reports that you're coding. And the truth is that instructors don't really have enough time during your program to explain this. So what I will do is I go through, for example, for the review session for next week, I'm going to actually walk through report coding. But just in case, you have some tips here on report coding that give you some basics about what to look for when you're coding a report. Do your best, right? Do your best. And again, some of the instruction that I've been given is that this is supposed to simulate you really being in a chair in a medical office, and the expectation that an employer or prospective employer is going to have. I've actually had students. I have one who's working right now. She's been on the job now for a year, who, when we did the reports, when we had to do the reports, I actually took my time. I utilized some of the material that's available to me as somebody who teaches people how to be certified. I added that for my courses. And I'll be showing y'all some videos. I added that, and we walked through some scenarios in coding reports. This student, and there are other ones I'm sure, but this student took everything to heart. As it turns out, she was a student who has been here. She's in the process of getting her citizenship, and she's was at that time she was here on a visa, right? While she's working on her citizenship. So she was extra motivated to do good in this class. And what she did is she coded as many reports as she possibly could. And when she went to her externship site, and this is the kind of stuff that happens, they were in such a bind, being behind with things and this and that, they very hurriedly gave her a report and asked her to code it just to see what she knew. And she coded it, and she got hired. After her externship, I think she had a paid externship, she got hired. So this is practice. I don't expect you to be perfect, but I expect you to make an effort, and I expect to be able to see the effort that you've made. And the expectation is that you know this. You know how to do these, even though I know that some of you may not have had the opportunity to learn, but I will review these things with you as you go through the course. Every now and then I'll jump in and do a treatment of how to break down evaluation and management. I'm not going to do that now because the rules around evaluation and management are actually changed a little bit for 2021. But I will do some treatment of some of these as the questions come up. Okay?
Miss Cheryl?
Yes.
I do have a question though, because speaking to my coordinator, she was saying that this is kind of like a all or nothing each week, and I don't understand. So basically, it's like either you pass it or you fail the week. I don't know what she meant by that.
Okay, so what she meant by that is that every Dropbox that you see here has to have an assignment in it. So if you miss any assignments, including the YouTube video, you don't get attendance credit. That's what she meant.
Oh, okay.
That's all. So that's the most important thing, that you get your assignment. You make the best effort that you can at all of your assignments, and you get something in each one of these drop boxes, or let me know ahead of time. Don't let me know on Thursday. Okay, because it's too late. And speaking of too late, if you start your work on Tuesday, you're starting too late. You can actually start today because the course is open now, and you have some understanding of how to navigate through it. And I'll get this video rendered as quickly as possible, which I'm going to just take a look. I don't think I've missed anything. Just don't forget about the YouTube video. I'm going to stop recording now.